Over the past year, I have relied almost exclusively on non-emergency medical transportation, NEMT, due to the progression of multiple sclerosis. While I anticipated that losing the ability to drive would be inconvenient, I did not anticipate how profoundly it would reshape my understanding of independence, disability, healthcare access, and quality of life. The most important lesson I have learned is this. When a previously independent person loses the ability to drive or safely use public transportation, they lose far more than transportation. They lose freedom. Transportation is often discussed only in the context of medical appointments. In reality, it is one of the most fundamental social determinants of health, influencing nearly every aspect of daily living. Reliable transportation determines whether a person can obtain groceries and household necessities, pick up prescription medications, attend medical appointments consistently, participate in rehabilitation or exercise, maintain employment or pursue new opportunities, visit family and friends, engage in community activities and social events. Over time, the consequences extend far beyond missed appointments. Social isolation increases. Friendships become difficult to maintain because accepting invitations requires coordinating transportation days or weeks in advance. Relationships suffer. Caring for pets becomes more complicated. Employment opportunities become increasingly inaccessible. Gradually, life continues moving forward while the individual is left behind. For this reason, transportation should not be viewed solely as a healthcare service. It is fundamentally a quality of life issue. Understanding the current NEMT model. Non-emergency medical transportation, NEMT, provides transportation for individuals who cannot safely transport themselves because of age, disability, or medical conditions. The system is largely funded through Medicaid and private insurance. In its simplest form, the process works as follows. Taxpayers fund Medicaid. Medicaid contracts with transportation brokers. Transportation brokers contract with local transportation providers. Transportation providers transport patients to and from appointments. Patients interact directly with the local transportation companies and their drivers. After more than a year using the system, one observation stands out. The vast majority of drivers I have encountered have been compassionate professionals who genuinely want to help. Likewise, most transportation providers appear committed to serving their communities. The greatest vulnerability appears to exist within the coordination layer, the transportation broker. Brokers are responsible for coordinating rides, monitoring performance, ensuring patient safety, and maintaining accountability across the transportation network. That raises several important questions. How are transportation providers evaluated? How is vehicle safety monitored? How is service quality measured? How are recurring service failures identified? How is patient safety confirmed after a ride is completed? How is accountability enforced when problems occur? From my experience, these questions deserve greater attention. A systems perspective. Before multiple sclerosis changed my life, I worked as an IT systems analyst. As a result, I naturally view these challenges through the lens of systems design and process improvement. Today, technologies such as GPS tracking, smartphones, digital verification, automated alerts, electronic checklists, real-time ride monitoring, and passenger confirmation are widely available. Many of the service failures I experienced, including communication breakdowns, scheduling errors, and preventable safety risks, could potentially be reduced through better use of existing technology, stronger operational oversight, and clearer accountability standards. Rather than relying primarily on reactive problem solving, the system should be designed to prevent failures before they occur. Looking forward. Based on my experience, I believe the current broker model warrants thoughtful evaluation to determine whether existing incentives consistently support patient safety, service quality, and positive health outcomes. This should not be viewed as criticism of transportation providers or drivers, many of whom perform difficult and valuable work every day. Instead, it is an opportunity to strengthen the system through improved coordination, transparency, technology, and accountability. Ultimately, every patient deserves transportation that is safe, reliable, efficient, transparent, dignified. Transportation is more than a ride. For millions of Americans living with disabilities, chronic illnesses, or age-related limitations, transportation determines whether they can fully participate in their communities or whether they become increasingly isolated from them. Improving transportation is not simply about improving logistics. It is about improving health, independence, and quality of life.